Homeo Guru. Please subscribe our channel. Press bell icon to get continuous updates. Exam oriented part 7. All of the following muscles are supplied by mandibular nerve except option A masseter, option B tensor tympani, option C tensor palatae, option D buccinator. Answer option D buccinator. Buccinator muscle is supplied by facial nerve. Complementary medicine of cinchona. Option A calcarea fos, option B digitalis, option C ferrum, option D selenium. Answer option C ferrum. Relationship follows well. Calcarea fos in hydrocephaloid. Incompatible after digitalis and selenium. Total lung capacity depends upon option A residual volume, option B size of airway, option C lung compliance, option D closing volume. Answer option C lung compliance. Lung compliance is a measure of the lung ability to stretch and expand. It is reduced in restrictive disease and pneumonia. Boys complaints after using tobacco. Options A arsenicum album, option B thuja, option C caladium, option D NUX-VOM. Answer option A arsenicum album. This symptom also seen in argentum nitricum and veratrum album. Mummification is due to option A putrefaction, option B desiccation, option C saponification, option D necrosis. Answer option B desiccation. Mummification. It is a rapid drying of the dead body due to environmental factors. Time required 3 weeks to 3 months. The repertory of HERING'S guiding symptoms of our Materia Medica was written by option A Boger, option B Jar, option C C.B. Ner, option D Edmund J. Lee. Answer option C C.B. Ner. Ner repertory. First edition 1896. Number of medicine 408. Number of chapters 48. Number of gradations 4. Corpus luteum is maintained by option A progesterone, option B FSH, option C LH, option D estrogen. Answer option C LH. Corpus luteum secrete estrogen and progesterone. LH half-life 30 minutes. LH surge precedes ovulation by 24 to 36 hours. FSH half-life 4 hours. Reaches peak at 7th day of cycle and decline at 18th day. Lack of vital heat in acute disease. Option A sepia, option B ledum, option C carbovech, option D pulsatilla. Answer option B ledum. Lack of vital heat in chronic disease sepia. Smallest chapter in Kent repertory. Option A vision, option B prostate, option C ear, option D nose. Answer option B prostate. Kent repertory. Largest chapter extremity. Lowest number of rubrics hearing. Maximum number of rubrics mind. Features not seen in Cushing's syndrome. Option A hypoglycemia, option B hypertension, option C frank psychosis, option D hypokalemia. Answer option A hypoglycemia. Cushing's syndrome due to excess production of cortisol from adrenal cortex. Most common symptom weight gain. Most common sign obesity. Symptoms: moon face, central obesity, amenorrhea, lemon on toothpick appearance, hirsutism, buffalo hump, hypertension. Metabolic alkalosis seen in following conditions except option A, methanol poisoning, option B, Cushing's disease, option C, vomiting, option D, diuretic therapy. Answer option A, methanol poisoning. Metabolic alkalosis seen in CA stomach, pyloric stenosis, vomiting, diuretic therapy. Respiratory alkalosis seen in hyperthyroidism, pregnancy, congenital heart failure, chronic liver illness. Violent palpitations from incarcerator flatus. Option A, coca. Option B, cactus. Option C, calcarea as. Option D, all of the above. Answer option A, coca. This symptom is also seen in Argentine Matricum NUX-VOM. Coca was first used as tobacco antidote. Delayed hypersensitivity is seen in following conditions except option A, Arthur's phenomenon, option B, contact dermatitis, option C, tuberculin test, option D, transplant rejection. Answer option A, Arthur's phenomenon. Examples for delayed hypersensitivity reaction: syphilis, LGV, multiple sclerosis, type 1 diabetes mellitus, typhoid, patch test for contact dermatitis. Has cured umbilical hernia with obstinate constipation after NUX-VOM failed. Option A, Staphysagria, option B, Cocculus, option C, Hecla lava, option D, Plumber met. Answer option B, Cocculus. According to HAHNEMANN, which one is most incurable disease? Option A, true chronic disease, option B, pseudochronic disease, option C, artificial chronic disease, option D, acute exacerbation of chronic disease. Answer option C, artificial chronic disease. True chronic disease due to chronic miasm. Explained in aphorism 78. Pseudochronic disease due to maintaining cause of avoidable noxious agent. Aphorism 77. Artificial chronic disease. Aphorism 74 and 75. Verwandschaften Repertorium published in the year option A 1832, option B 1836, option C 1835, option D 1853. Answer option B 1836. Written by Boni Hassan, also called an attempt at showing the relative kinship of homeopathic medicines. Sphere of action of bryonia in option A, serous membrane, option B, cellular tissues, option C, fibrous tissue, option D, cartilages. Answer option A, serous membrane. Epis, cellular tissues. Rustox, fibrous tissue. Ruta, periosteum and cartilage. Sepia, portal system. Example for fixed miasm. Option A, dengue fever. Option B, smallpox. Option C, hepatitis. Option D, typhoid fever. Answer option B, smallpox. Fixed miasms. Fixed miasms are two types: acute miasm and chronic miasm. Acute miasm is again classified into recurring miasm and non-recurring miasms. Example for recurring miasm: cholera and plague. Example for non-recurring miasm: smallpox, whooping cough, measles, scarlet fever. Chronic miasms are SORA, psychosis and syphilis. GETTLER'S test positive in option A, hanging, option B, drowning, option C, strangulation, option D, firearm injury. Answer option B, drowning. GETTLER'S test. Normally, the chlorine content is equal in both right and left side. Its normal value is 600 milligram per 100 ml. In freshwater drowning, the blood gets more diluted. That is, 72% of blood is diluted within 3 minutes. So the chlorine in the left side is 50% lower than usual. But in seawater drowning, the chlorine concentration is increased. A difference of 25% in chloride content is considered as significant. Evaluation of drugs in card repertory was first introduced by option A. R.H. Fairley, option B. W.J. Guernsey, option C. Marcos Geminis, option D. M.L. Taylor. Answer option C. Marcos Geminis. This card repertory is published on 1948. It's a colored and perforated card repertory. Grades of remedy first introduced in this card repertory. Red color indicate 3 mark, blue color indicate 2 mark. Thank you.